Thank you all for coming. My name is Emma Lovell, and I'm a research officer at the Overseas Development Institute. I want to start by thanking the government of Japan for hosting this conference, and to UNISDR for giving me the opportunity to speak at this stage. To address vulnerability to risk, DRR planning must be inclusive and based on different people's needs, skills, and capacities. Today, I want to talk about the importance of inclusion and empowerment of at-risk groups in the Sendai framework. What I mean by this is the inclusion of gender, age, disability, and cultural perspectives in DRR. We are all here at the World Conference to agree on the Sendai framework. I want to start by saying that the framework has generally done a good job at including vulnerable and at-risk groups in DRR. I've been impressed by the way that the recognition of the need for inclusion and the need for the participation of vulnerable groups in DRR planning and implementation. However, references to local empowerment have been weakened this week in discussions, and drafts do not say how progress on social and cultural dimensions of DRR will be promoted, accounted for, and by whom. There are 4 main points I'd like to discuss today. The first, that marginalized groups are more likely to suffer from disasters. But at the same time, disasters exacerbate vulnerabilities and social inequalities. Vulnerable groups tend to be excluded from DRR decision-making and implementation, therefore making them even more vulnerable to disasters. However, their inclusion as active agents of change can help build effective and equitable resilience. So let's look at this in more detail. Globally, exposure to disasters is increasing as more people and assets are located in hazard-prone locations. This is due to population increase, economic pressure, more people living in exposed areas and coastal areas, and the degradation or loss of natural ecosystems. At the same time, people's vulnerability to disasters is dependent on different social, economic, cultural, and political processes that exist within society. Marginalized groups are more likely to suffer the effects of disasters, regardless of whether they live in developed or developing countries. This is due to poor living conditions, inadequate infrastructure, lack of access to basic services such as education and health, and a lack of income diversification. The fact that more women are killed than men in disasters is really disturbing. Let me give you an example. A 2005 Oxfam report tells us that in 4 villages in northern Aceh in Indonesia, out of 366 deaths, a staggering 284 were female. This is 77% of those that were killed during the disaster. So why is this? Well, there are a number of contributing factors as to why women globally are more likely to suffer the effects of disasters. This includes gendered roles and responsibilities within society and within the family, social restrictions which may limit their mobility, and a lack of political recognition of their needs and perspectives during a disaster. Disasters are a global challenge that threaten to reverse years of development gains and threaten international efforts to reduce poverty by 2030. Not only are people living in poverty and marginalized groups more likely to experience the effects of disasters, but disasters also exacerbate vulnerabilities and social inequalities. Just 1 or 2 extreme events can have devastating impacts on the development gains of a country and can affect health, education, income, and employment opportunities, therefore trapping people in poverty. At the same time, smaller events can have similar impacts as people are unable to cope with, manage, and recover from these recurring hazards. From years of experience, we know that disasters can prevent children from going to school, affecting their education and exacerbating their vulnerability to disasters. The complex links between disasters, education, vulnerability, and the rights and roles of children can have devastating impacts and can exacerbate their vulnerability. This needs to have much stronger recognition in national and international DRR frameworks. We have a duty to take this into account. Many groups face exclusions that exacerbate their vulnerability to disasters. And this means they are often excluded from participating in DRR decision-making and implementation that affects their lives. DRR planning and implementation tends to overlook the various social dynamics, power relations, and the diversity of local needs, knowledge, and capacities of different people, which impacts on the effectiveness and sustainability of DRR initiatives. At the same time, DRR monitoring and evaluation often tends to ignore data or doesn't have data disaggregated by gender, age, disability, and ethnicity. This makes it even harder to assess the number of people being affected by disasters, but at the same time will have an impact on the amount of financial aid and support that these vulnerable groups experience and have received before, during, and after a disaster. So, how many people living with disabilities have a personal preparedness plan for disasters? And of those, how many do you think have someone to help them evacuate during a disaster? Going from left to right, 71% of people do not have a personal preparedness plan during a disaster. Only 31% always have someone to help them evacuate. And 13% never have anyone to help them evacuate. And this is from a UN global survey of persons living with disabilities. People with disabilities report that they are rarely consulted about their needs, despite being in the best place to assess them and know how to deal with them during an emergency. The focus on vulnerability does not recognize the numerous ways that people cope with and manage to recover from disasters. DRR interventions need to acknowledge and draw upon local knowledge and experiences, perspectives, and capacities in order to build resilience effectively and equitably. For example, child-centered initiatives can help strengthen adaptive capacity and empower children and young people as active agents of change. Young people can act as key informants and raise awareness about natural hazards and DRR activities. They have also demonstrated the ability to identify roles and responsibilities during a disaster. But it is essential that this participation is meaningful and that child-centered approaches avoid tokenism or manipulation. DRR activities should not place too much of a burden on the children or young people, and adults and organizations need to play a supporting and mentoring role during these initiatives. Many lives could be saved when DRR interventions acknowledge and draw upon local and traditional knowledge and capacities. In another example, in the 2004 Indian Ocean tsunami that hit this Indonesian island, people used oral history of what happens to the ocean and how buffalo retreat to the hills in order to warn them of a tsunami. As a result, they used this traditional early warning system to retreat to the hills themselves. And only 7 out of 78,000 people were killed during the disaster, despite being located 40 kilometers away from the epicenter of the earthquake. To address vulnerability to risk and ensure that DRR planning is inclusive, Initiatives must recognize people's human rights, as well as their various needs, vulnerabilities, expectations, and capacities. By promoting inclusion and participation, vulnerable groups can become active agents of change. And this is crucial to build resilience effectively and equitably. I have copies of a recent paper I have written at the back, and I'd be happy to answer any questions that anybody might have if you come and see me. Thank you very much for this opportunity.